The National Health Service is buckling, and Prime Minister Andy Burnham places the blame squarely on broken social care. Right now, 13,600 medically fit people are stuck in hospital beds every day, unable to leave because there is no adult social care available. That exit bottleneck prevents new patients from being admitted, causing a chain reaction of overcrowded corridor care throughout the NHS. Burnham says he is willing to spend whatever political capital he has to fix this. His proposed solution is to build a new care system operating on the exact same principles as the NHS, free at the point of use. Ultimately, expanding the health service without clearing the backlog at the exit is a losing game. Fixing the social care pipeline determines whether the NHS can actually remain sustainable. Building a universal care system comes with a massive catch. It requires astronomical long-term taxpayer investment. To navigate this, Burnham invited opposition leaders Kemi Badenoch and Ed Davey here to number 10, hoping to forge a unified, cross-party funding solution. But the consensus cracked almost immediately. Conservative leader Kemi Badenoch drew a rigid red line. Her party will not support tax rises or increased borrowing. She demanded that any reform be funded entirely through spending cuts. Meanwhile, Liberal Democrat leader Ed Davey insists any deal must explicitly include support for family carers before his party will consider backing new tax changes. This gridlock is exactly why social care is British politics' third rail. For 2 decades, no party has wanted to look the public in the eye and tell them they must pay significantly more. The tension reached a boiling point when rumors began circulating about a so-called death tax, a proposal to scrap inheritance tax and replace it with a flat 10% levy on all estates to pay for care. Despite a sudden media frenzy, the government quickly and officially denied any plans to implement this specific 10% levy. If this panic feels familiar, it is. Back in 2010, Gordon Brown proposed his own national care service, and it was completely derailed by these exact same death tax attack lines. While politicians retreat from these debates, research into public opinion suggests the funding models Westminster fears most are no longer the political suicide they once were. The political panic over funding is based on assumptions from 20 years ago, and that fear is now severely limiting the solutions politicians are willing to discuss publicly. This data from a recent Loughborough University study illustrates the gap between the room and the street. When asked to choose between realistic funding packages, the English public showed a strong preference for using progressive taxation and wealth taxes to expand social care. The study also established clear boundaries. Voters outright rejected the idea of expanding private insurance, and they strongly opposed extreme means testing that only helps those with the fewest assets. Perhaps most surprisingly, a voter's own wealth or home ownership status had almost zero impact on their choices. People preferred a fairer system, regardless of whether it hit their own pockets. Despite this public appetite, recent reporting from The Londoner reveals a critical truth about Burnham's current plan. There actually isn't one yet. No funding model has been finalized. Instead, Burnham has launched an expedited independent review led by Baroness Louise. Her task is to determine the underlying values of a new care system first, before establishing a final price tag. The current battle you're seeing in Parliament isn't actually over a specific new tax. It is a fight over the ideological framework of who should bear the burden of a modern society's care. The government has very little room to maneuver.
A stagnant economy, high national debt, and lingering inflation restrict their ability to absorb these massive new costs without generating new revenue, and the timeline is tightening. Baroness Casey's review, which was meant to take until 2028, is now expected to deliver its final recommendations on long-term funding by the end of this year. Burnham has publicly staked his entire premiership on solving this crisis before he leaves office, turning those upcoming recommendations into a make-or-break moment for his leadership. If these political leaders fail to break their 20-year deadlock over funding, the entire health system will inevitably buckle under the weight of an aging population. Because no final funding model has been announced, this high-stakes negotiation is evolving rapidly behind closed doors. To follow these live updates, expert analysis, and the ongoing breakdown of Burnham's social care funding plans,